Most of us think the best way to reduce the belly fat is by doing hundreds of crunches or spending hours together in a gym, but it is not so. To bring back your belly to normal shape, it is important for you to understand the reason behind it. The reason for this belly fat. When you understand, when you try to eliminate root cause, then it's easy for you to bring back your tummy into normal shape. One type of belly is stressed belly. If you see if there is more fat deposition around your abdominal area, around your navel, and when you try to touch it, if it is harder, then that indicates it's a stressed belly. Stress increases cortisol levels in our body, and that is directly related to obesity. When we are exposed to prolonged stress, our brain's ability to manage our appetite is reduced. So we are always in a state of hunger and we tend to overeat. And mostly we eat processed food. This will impact our inflammation levels, insulin resistance, and sleep disturbances. And all these things will impact our overall health and the belly fat. So when we are not sleeping properly, our body's ability to burn the fat is reduced. So if you have this type of belly, so you have to work on your stress levels. Stress can be for various reasons, but if you understand the reasons for your stress and work on it by doing some specific stress relieving breathing exercises, meditation and yoga, then you can reduce this type of belly. Another type of belly is bloated belly. Sometimes when you wake up in the morning, your tummy looks very flat. As the day progresses, then you can see the bloating, belly bulging. It is because of indigestion and there are too many gases in your belly. It happens because of bad food, bad diet and food intolerances. If you are not eating food according to our body type, then we see this kind of bloating belly. So if you have this kind of belly, if you feel bloating in the evening, it is important for you to understand your diet pattern. Work on your diet. Whenever you see more bloating, those days you have to check your diet and see what food item is causing you this bloating belly and try to reduce or avoid it. Maintaining a food diary will definitely help you. So when you do changes in your food, more chances of reducing this kind of belly. The kind of belly is hormonal belly. If it is like a cushion, and if you see the fat deposited around your abdomen, hips and thighs, then that indicates it's a hormonal belly. That belly fat deposition is because of the imbalances in hormones. Conditions like thyroid, PCOS, menopause, so there will be changes in the hormones. There will be imbalance in the hormones. So trying to work, if you have any of these conditions, it is important to treat those conditions. At the same time, doing exercises which balances your hormones is very important. General walking, yoga, and especially working with weights, strength training is very important to bring back the hormones into balance. So when you see fat deposited around these areas, that indicates a hormonal belly and you have to work on balancing your hormones. Another type of belly is mommy belly. Some women look pregnant after months and years of giving birth. You do your exercises, you take proper diet, but still your tummy does not go away. Your whole body weight reduces, you look very thin, but your tummy still protrudes. So it is soft and bulgy. So if you see this kind of belly, that indicates it's a mommy belly. During pregnancy, to accommodate the baby, the connective tissue in the front of your abdomen opens out to accommodate the baby. Usually it closes after 2 months. For some women, it does not close. That condition is called diastasis recti. If you have diastasis recti, then you see this kind of belly. Then in these conditions, you should work on your core muscles. When you start exercising your core muscles, when you strengthen your core muscles, then more chances of reducing this kind of belly. Diastasis recti is more common in women because of pregnancy and childbirth, but we also see this in men. It is because of long sitting, bad postures, lack of exercise or activity, and lifting weights, bad body mechanics. So all these things contribute mommy belly. So if you have this kind of belly, definitely work on your core muscles and you will see the change. So before working out, before doing any form of exercise for belly, it is important to understand what type of belly you have and work on the root cause. That will definitely give you good results.